Everyone, this is the second part of the LV diastolic function video. So if you haven't watched the first part, I would encourage you to see that for the mnemonic. So in patients who have LV diastolic dysfunction, or in patients with depressed LVEF, or hypertrophy or older age, and you think they have diastolic dysfunction, this is the algorithm that you use. Um, and so normally you have your E wave, which is the mitral inflow, followed by the atrial contraction. And normally the mitral inflow, the height of the E wave is more than the height of the A wave. And so if you have a filling pattern where the A wave height becomes greater than the E wave, that would mean that the E over the A ratio would be less than 0.8. Then there is just no question that the patient would have a grade 1 diastolic function with the normal LA filling pressures. The E velocity is less than 50 meters per second. Now, as diastolic function continues to decline, you have elevated LV filling pressures, and the um, atrial compliance also decreases, and your atrial contraction is not that effective anymore. And so you have this pseudo normal filling pattern that we'll talk about, which kind of looks like a normal filling pattern. So your um, E over A wave is somewhere between 0.8 to 2, and or if you have a discrepancy between the two that we talked about right now. And that's when you think of the three criteria that need to be evaluated. And so we talked about the mnemonic. So 7 times 2 is 14, 7 times 4 is 28, so 2.8 of the TR jet velocity. And then 35, 7 times 5 is 35, so 34 LAVI. And if all of the criteria are positive, this means that the patient has grade 2 diastolic dysfunction with an elevated left atrial pressure. And if they have two of the three or all three negative, then they have normal left atrial pressure with a grade 1 diastolic dysfunction. And then if you have only two criteria and you really can't evaluate, it's a 50-50 thing, whereas one is positive, one is negative, then you cannot determine the LA pressure and the diastolic dysfunction grade. And then as time goes by, LV filling pressures are so elevated that you have a steep slope with the E wave and a small A wave. The A wave is the atrial contraction still not really good. And so if the E over the A wave is greater than 2, that means that you have a grade 3 diastolic function dysfunction with elevated left atrial pressures. That's all. Hope that helps. Stay awesome. I also wanted to add that the diastolic dysfunction algorithm is not very perfect, and then you have a lot of other things that you can evaluate to look for if the patient has diastolic function, including the pulmonary veins, um, and deceleration time and things like that. But that is beyond the scope of this video. But I would highly encourage you to look at the Mayo Clinic videos for the, understanding diastolic function dysfunction. And there's a video by Jo, which is really good. It helped me understand diastolic dysfunction. And then I read the text from Brownwald, and that helped me. So I hope that helps you too. Stay awesome. Bye.